Phlebotomy equipment. Tubes. Tubes used for phlebotomy are all colour-coded. Each tube contains different additives and serums, which make the blood act differently in readiness for testing. Tubes differ in size from adult to paediatric bloods, and also in size due to the amount of blood required for the specific tests. Vacutainers. Vacutainers are considered the most efficient way of obtaining a blood sample. The closed system draws the blood into the vacuum tube without the sample being exposed to the air. Manufacturing companies' designs slightly differ. A transparent plastic holder houses the double-ended needle to attach the tube. The holder is also attached to the end of the tube connected to the butterfly system. Butterfly needles. Butterflies are generally used to obtain samples from hands and feet and paediatric patients. Sometimes these are used in the arms of patients particularly unwell or receiving chemotherapy. The butterfly has a flashback section which allows the phlebotomist to see that they have located the vein. Butterflies are also referred to as a winged infusion collection needle. Syringes. Some healthcare settings still use syringes attached to the end of a butterfly system to draw blood. This isn't common practice, as syringes can be quite fiddly to obtain the sample with. The syringes can break down the cells, which can in turn make the sample less accurate than a sample collected with a Vacutainer system. Green and black needles. There are three main types of needles used for phlebotomy when samples are taken from the arm. These needles are not for use within the hands and feet. We start with standard double-sided needle. Flashback double-sided needle. This needle allows the phlebotomist to see if they are actually in the vein before they attach the tube. Safety double-sided needle. This needle, once withdrawn from the patient, has a safety harness to go over the needle to protect the sheath. Tourniquets. The healthcare setting, along with their infection control standards, will dictate the tourniquet to be used by the phlebotomist. Fabric tourniquets are a stretchy piece of fabric with a plastic clip. These were generally used, but now stricter infection control standards have come in. These are not generally used. Disposable tourniquets with pre-made holes and clips. These are generally the choice of tourniquet. They go onto the patient's arm with the clip pointing outwards so it can be inserted into the pre-made hole for the tightness of the tourniquet. Also, tourniquets come in disposable tie-on tourniquets, which are tied into a bow for easy release after the procedure. A glove or anything other than a tourniquet should never be used as a tourniquet. Sharp spins. Sharp spins that are commonly used within phlebotomy are the orange or yellow lidded bins. Your sharp spins should always be kept a safe distance from your patient, but also within easy reach for the safe disposal of your sharp. Sharp spin lids should remain closed whilst in transit. Labels located on the sharp spins should always be filled in with the name of the hospital, department, date and initials of the member of staff who has put the bin together and who closes the bin once it is full.